Good afternoon and welcome to our daily media briefings. We're going to hear again from Supervisor Fletcher on an update on our informational charts and graphs, and then from Dr. Eric McDonald on their update on our medical cases. But before we get to them, I wanted to make note of a very special day today. Today is the 50th anniversary of Earth Day. I can't think of a more meaningful or appropriate time in many respects to celebrate Earth Day than right now. All of us are longing to get outside to enjoy the blessings of nature that have been bestowed upon our San Diego region. And certainly our regional parks, our beaches, our bays are out there inviting us all to come. As a county supervisor, I've worked over the years to improve our parks, create community gardens, and to build outdoor recreational amenities like the Bayshore Bikeway. So trust me when I say I'm missing the outdoors too. As we mentioned yesterday, we are soon hoping to be able to lift some of the restrictions on outdoor activities. We can only celebrate Earth Day in a limited way today because of the ongoing pandemic and the necessity to stay at home and avoid large gatherings. But there are small things we can all do right here within the confines of our public health order. You can plant some seeds in your gardens. If you don't have a yard, then take a walk around your neighborhood and pick up the trash you see. Remember, we're not prohibiting walks around your neighborhood, but we do ask that you wear a facial covering in case you bump into a neighbor. I know a lot of us have been stocked up on groceries and supplies over the last few weeks. Now is a good time to sort out your recyclables. Another idea is to plan for the future by joining an environmental group or signing up for an upcoming event. California Coastal Day is set for September 26 this year. Hopefully we'll all have a chance to get out and help clean up our beaches and bay then. And if you have children at home, we have a way for them to celebrate Earth Day too. Our county land use and environmental group has a special Earth Day virtual celebration with a website that offers something for everyone, from coloring contests to Facebook Live park events, virtual hikes, science and technology activities, ebook collections, and more. To check it out, go to sandiegocounty.gov/Earth-Day and check it out. Now, before we get to the presentations, I just want to acknowledge that Supervisor Nathan Fletcher and I were selected or asked by our colleagues to serve as the COVID-19 subcommittee to deal with media issues and to work with our public health officials. But I don't want anyone to think that our colleagues on the board, which certainly includes Supervisor Diane Jacob, Supervisor Kristen Gaspar, and Vice Chair Jim Desmond, aren't busy in their districts. I can assure you they are. They're holding virtual town hall meetings. They're helping to gather needed equipment. I know Supervisor Gaspar was instrumental in getting a number of hospital beds donated. And I know that both Supervisor Gaspar and Desmond have been working in North County with the business community. Supervisor Jacob last night held a virtual town hall. They're all actively engaged in their communities and helping all of us to work through this pandemic. And I want to thank each and every one of them for what they're doing in their districts and for the entire county of San Diego. With that, we'll go ahead and get started with the report, starting off with Supervisor Fletcher.
Thank you, and good afternoon. Before we get to our informational charts, today the governor updated the public on the statewide progress on the 6 key areas that the state is using to guide and prepare for a potential easing in the future. Today in particular, they focused in depth on the issue of testing. In addition to our monitoring the metrics which have been previously shared that we need to see in order to unlock or move us forward into a potential easing, primarily those of rates of hospitalizations and percentage of positive tests. We know that as a region, we need to have the appropriate capacity around testing, tracing, and isolation. That is a core component, not just for San Diego and for California, but every jurisdiction as they look towards the future in terms of how they will prepare for that scenario. Last week, we announced a task force had been assembled to focus exclusively on this issue. This task force continues to work. We are coordinating with both state and federal officials on guidance, assistance, the possibility of coordination. Today we had a lengthy meeting and continue to work hard on preparing for that time in which we may be able to move into some changes in posture and some easing of the dials. In the coming days, we hope to share a more detailed announcement with specific goals and metrics, but right now I want to give you a quick update on the things and the general direction we're working on. We are focused on assessing the actual number of tests we need as a region every day in order to move to the next phase. There have been some numbers mentioned by both state and federal officials, some referenced in the media as a number out of every 100,000 residents. We're going to continue to work to firm up what we believe our San Diego daily capacity should be as a goal. And that would be a goal not just for capacity for tests, but all of the various pieces that go along with the test. The personnel, the PPE, the swabs, everything that makes a test become a reality to ensure that whatever that daily goal is one that we can achieve each and every single day. We also have to identify the proper protocols for who should be tested in what order to meet that daily capacity. There is some guidance out around state guidance, federal guidance. We need to assess what we believe would be most appropriate for us here in San Diego County. And given that testing is done through a variety of partners, clinics, commercial labs, hospitals, the county, ensuring that we are all on the same page will help us. Once we settle in on what is that daily goal and what are those protocols, then we will need to make an assumption of what percentage positive we think we will get. And this will guide our contact tracing. When we have an estimate of what percentage positive we think we get, we will estimate how many close contacts we think each one of those individuals will have, and that will shape how many individuals on staff trained to do contact tracing that we need, and that will guide our goal around there. When it comes to isolation, we're certainly ahead of the curve here with the large number of public health motel rooms that are available for individuals who cannot isolate on themselves. Again, we hope to release some specifics around this in the coming days, but know that we are working hard to ensure that this component of the next phase is ready to go at such time that the metrics and our public health experts determine it is time to take that next step. Now we will jump into our reports. Today we're reporting 9 additional deaths and 57 new positives. There you can see 57 new positives, taking us to a total of 2,491 cumulative to date. Number of testing today, we're reporting 1,514 tests, which takes us to over 36,000 cumulative tests that have been done throughout the San Diego County region. The next chart here represents a variety of things all outlaid in one. You see our positives along with the doubling rate of every 23 days, which is an encouraging number. The estimated number of recoveries, hospitalizations are up 19 from yesterday at a doubling rate of every 21 days. ICU beds are up 7 from yesterday, a doubling rate of every 28 days. And the loss of life is up 9 from yesterday, a doubling rate also of every 9 days. Slight uptick in motel rooms in both public health rooms of occupied and guest, along with the Regional Task Force on Homeless Rooms, increase in occupied and guests. Pretty significant jump in our personal protective equipment. You can see a pretty good jump in surgical face masks and gowns. I know that there's been considerable effort on the part of our staff here at the county to acquire those and make those available to our healthcare systems. We're now just shy of 2.3 million individual items of personal protective equipment that have been distributed. As usual, increase in 211 calls, nurse calls, epi calls. Hygiene kits distributed have now surpassed 4,000 individual hygiene kits that have been distributed primarily to unsheltered individuals. Hand washing stations remain the same, slight downtick in toilets distributed because they were at locations where permanent restrooms have been brought online. And our final chart on ventilators, just 20 out of 23 hospitals reporting when we ran today's report, 533 ventilators available. No change in the numbers that are being requested, serviced, and ready to deploy. I'll now turn it over to Dr. Eric McDonald for his report.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and thank you for listening in to this briefing today. If you can put the first slide up, regarding the global, national, and state statistics based on data from the Johns Hopkins dashboard from about 11:30 today. Globally, over 2.6 million positive cases have been reported, including over 181,000 deaths. Nationwide, over 834,000 positive cases have occurred, and this includes approximately 46,000 deaths. Statewide, approximately 36,000 positive cases, including over 1,300 deaths. And today, the County of San Diego is reporting 2,491 cases, which is 57 cases more than yesterday, as well as 96 deaths, which is 9 more than reported yesterday. On the 9 additional deaths, these include 3 women, ages 68, 96, and 99, and 6 men, ages 38, 65, 66, 78, 83, and 86. All 9 of these individuals had underlying medical conditions, and these deaths occurred between the 17th and the 20th of April. And it gives me a chance to comment that remember that deaths are a lagging indicator of the impact of a communicable disease. It takes time for someone to develop symptoms, often be diagnosed with an illness, and then it sometimes takes time for an individual's illness to progress, and unfortunately, many of those end in death. So it also takes time for deaths to be reported. Physicians have up to 8 days to submit a final death certificate, and so all of those factors combine to make deaths a lagging indicator, which is why deaths specifically are not a indicator that's being used to make decisions about satisfying a criteria to have phased opening. It's not one of the criteria that either the state or the federal government is using. It's important, and it's important that we focus on the impact on family and friends of these deaths, but it's not one of the criteria that's being used to make overall decisions. Of the 2,491 cases, perhaps the next slide can go up, the range of reported cases remains unchanged from 3 months to 100 years of age. The percentage of cases between the ages of 20 and 49 years of age is remaining constant over time at about 51%. 1,271 cases, or 51%, are males. 611, or 25% of the cases, have been hospitalized. And this includes 206, or approximately 8% of the total, who have been admitted to the intensive care unit. Lastly, the 96 deaths represent approximately 4% of the number of cases reported, which is a little higher than some other jurisdictions are reporting. And this is one of several indicators that there are undiagnosed COVID cases in our community. Of the 96 deaths, and I think this is on the next slide. Yeah, there we go. 56% were male, which is a bit higher than the overall number amongst the reported cases. And we have data for 92 of the 96 deaths on race, ethnicity. And of these, 51 or 55% are white, 28 or 30% are Hispanic or Latino, 9 or 10% are Asian, and 1% are in each of the following categories: American Indian, Black or African American, Pacific Islander, and multiple races. And I would like to personally, and on behalf of all of us here at the county, extend our sympathies and condolences to the family and friends of the deaths, not only that we've announced today, but really all of the deaths that we've talked about and the impacts on those family members. I do want to have as a reminder that all of our demographics are on the county website, which is on the placard in front of me. And I do want to call attention to the fact that we do have data on cities and the unincorporated area, and also zip codes that we have published in terms of numbers and percentages. But starting with what we published later today, we will be including rates, that is numbers of cases per 100,000, so that it's a little easier to compare one location to the other. But I do want to be very quick to say that we are reporting this information because it's been asked for, and I think it is important for overall transparency, but where somebody lived isn't necessarily where somebody contracted a disease or was contagious. And so as long as you keep those caveats in mind, you can then compare one location with another. Regarding outbreaks in congregate and community settings, today we're reporting a total cumulatively of 35 confirmed active outbreaks and 1 inactive outbreak. And an inactive outbreak is one in which a case has not been reported for at least 14 days. These outbreaks include 24 active outbreaks in congregate facilities, and these facilities represent 419 cases, or 17% of all the cases that have been reported, and 43 deaths, which is 45% of the deaths that have been reported. 11 active outbreaks have occurred in community setting locations, and this represents 72 cases, or 3% of those cases reported, and 2 deaths, or 2% of the deaths that have been reported. And this is 2 more community outbreaks than we reported yesterday. Regarding testing, as of April 21st, county hospitals and commercial laboratories have conducted 36,434 tests, which includes the current total of 2,491 positive tests, which is 7% of all of the tests combined. So those are my remarks, and I'll turn it back over to Supervisor Cox.
Thank you, Dr. McDonald. We'll get right to the questions. And again, as we call you up for your comments, please make sure if you haven't been introduced by your name and outlet when you're called up, please do so before you ask your question. Let's go to the first one.
KPBS, please state your name and question.
Hi, my name is Matt Hoffman calling from KPBS. We're starting to see cities like National City issuing these emergency orders requiring everyone in public to cover their faces. Now, this is a step that you all have not taken at a county level yet. Do you believe that this is a necessary step and or something that you're looking at to expand countywide?
Dr. McDonald?
Yeah, if you could actually repeat the question, because we actually didn't hear it very well. So I think you were talking about National City, but if you could just be a little more clear.
Yeah, sorry, it's probably this phone case I have. I'm just going to see if, as we start to see some of these cities issuing these emergency orders for people to cover their face, I know that the county has not taken this step or issued an order countywide for that. Is this a necessary step that you believe that cities need to take, or something that you guys are looking at implementing countywide?
Well, I think it's good that local people are making local decisions about what should be done. And again, one of the comments I mentioned in my remarks is that the rates per thousand are going to be reflected in some of the statistics that we've showed. I'll say that in the county overall, the rate per 100,000 of the population is just under 75 cases. But it turns out that National City actually has a higher rate per 100,000, and they are aware of this and tracking it, and I think that they are making a local recommendation because of the increased number of cases that they're having locally. So we would support local decision makers making that kind of decision.
Gotcha. I know that, is there any evidence we've seen, like obviously Riverside County, it's been in place there for a while. Is there any evidence that requiring, instead of just essential workers, that, putting a kind of a blanket recommendation down for everybody in public, that will reduce the spread or kind of reduce infection rates?
Well, certainly adopting the use of the masks in public is going to reduce it. Whether it's required or strongly recommended, I think is, again, a local decision that should be made based on local information. Certainly, they've had a lot of cases in Riverside County. I believe their rates are higher than ours. So again, each individual location should be making these targeted recommendations to the citizens in their jurisdiction.
Thank you.
Okay, let's go to the next question.
NBC 7, please state your name and question.
Hi there, this is Priya Sridhar from NBC 7. You mentioned that you're creating a testing task force that's going to provide some broader guidance to the people performing the test, but we've also seen reports that hospitals are only testing at about 25% of their capacity. Why is that?
Okay, Dr. McDonald.
Well, thank you for that question. A similar question was asked yesterday about why there's a gap between the number of tests that are being performed and the actual capacity. And I gave I thought, a fairly comprehensive answer yesterday about that. Again, the distance can be described or can be attributed to a number of issues. But remember that tests are ordered by physicians in healthcare systems, and they follow our overall priorities that we've established in the county, which follows actually the same priorities that the state and the CDC have on who should be tested first. As each system has more and more capacity, you'll see them expanding the groups of people that they actually do testing on. And each system has different needs and criteria and access to personal protective equipment. And so we are going to see some differences across different systems on how they increase the number of tests ordered to meet the capacity. So hopefully that answers the question.
Okay, let's go to the next question.
Union Tribune, please state your name and question.
Hi, this is Paul Sisson at the UT. I see Governor Newsom today had an announcement and then a subsequent press release talking about allowing hospitals throughout the state to resume elective procedures. In his comments, it sounded like this could happen immediately with hospitals. The press release that came out after that makes it seem like there's going to be some additional process involved, something to do with the Western States Pact with in another state. So I wonder if you can tell me a little bit about kind of when we might, how does this affect our local hospitals in terms of restarting elective?
Dr. McDonald will be here to answer that.
I can tell you that this very topic was among the topics that were discussed earlier this week by the leadership of the hospitals across the county, recognizing that there is capacity in the system to take care of more than just COVID patients. There was a thoughtful discussion amongst the leadership of the different hospitals on this topic to really decide when expanded hospital-based services can occur in the face of what's happening in the community. That term elective surgery is a little deceptive in the sense that what might have been elective last month is now no longer elective because it's becoming more urgent for somebody to be taken care of. And all of our hospital systems here are aware of that dynamic and are eager, in fact, to provide these needed services to San Diegans. The question is, each system has to look at their capacity, their queue of individuals who need this type of surgery, their availability of intensive care units and operating rooms and staff to be able to do that, and most importantly, PPE. A lot of the things that used to be done even as outpatient surgeries, as inpatients, are now being done as outpatient surgeries, but the PPE requirements in order to do that are just as intense, whether they'd occurred either in the hospital or out of the hospital. So each system needs to look at their availability of equipment, particularly the gowns, gloves, masks, and to be sure that when they bring on these new surgeries in particular, that it doesn't affect their ability to respond to any surges of COVID patients. Does that address your question, Paul?
I wonder, so are you saying that the county really has no say-so here in terms of who restarts and when? So we could literally see hospitals start up tomorrow and another take another weeks, and it's pretty much just up to the hospitals, not really the county?
Well, I don't think you're characterizing it quite the right way. I would say that really all of the hospital systems rely on each other and rely on a system to be able to be sure that San Diegans get the care that they need. I know that our agency director likes to use the word co-opetition in the sense that these are groups that do compete with each other, but they also know that they rely on each other to provide needed care to everybody in the county. So we are facilitating and encouraging that dialogue and making sure that all of our systems move forward together so that we are prepared as a community to respond to changes in COVID, yet increase needed medical care for those who need it that is not COVID related.
I'm still a little unclear in terms of whether they can just go forward tomorrow if they want.
Well, our health officer order applies to them now to restrict what they're doing, but we are on active conversation with them literally on a daily basis so that we can expand healthcare services when it is supportable by current resources.
Thank you.
Okay, we have one final call in, and then we'll get to the texted questions.
Kaiser Health News, please state your
Hi,
name.
can you hear me okay?
Yes. Can you please state your name and question?
Hello?
Hi. Angela, go ahead and state your name and question.
Oh, hi. My name is Angela Hart. I'm with Kaiser Health News. And I'm sorry, I can't hear. Can you guys hear me okay?
We can hear you.
Oh, great. Okay, great. Thank you. Dr. McDonald, I actually had a two-part question. I'll start with most important, and then if you have a moment to take the second part, I'd really appreciate that. We're looking at testing the situation on the ground across the state, and I just wanted to hear from you, what is your biggest challenge with getting the testing up and running and the supplies? And if you could maybe talk to me about, we're here, like, have you had to get creative in getting the testing supplies that you need? And if so, how?
Well, I'm perhaps not the best person to answer that question. Again, we do have a task force specifically that's working on these issues, and our public health director can probably address the really down in the weeds specifics on that. But I can tell you that there are challenges across the board, whether it's reagents for specific machines, whether it's the viral transport media being available at the right place to be able to do the testing. The swabs are often an issue. I would say that each medical system has its own challenges with making sure that they can deliver on the potential capacity that they have. The good news is it does improve every day. Our own public health lab has expanded its capacity by having multiple platforms that have been brought on board and validated, and we're using those platforms in a very directed way to make sure that we support the populations that the county is most directly responsible for, including individuals who are first responders and individuals who are in skilled nursing facilities and in vulnerable populations. So I think, again, each system has different challenges, and I'm sure as you've talked to the systems, you've heard different stories from different groups, and that's because it really depends on what machines they're using and how much of each specific supply that they have, whether they're able to, in fact, deliver the full testing capability for their patient population. And what was the second question?
I appreciate that. And the second part is, how many tests are you guys able to conduct right now per day? And in an ideal world, what's the goal? Do you want to be able to test every person multiple times? Like, what's the ultimate goal?
Well, I would refer you back to the specific charts that we presented on the number of tests that are available both in commercial labs and in the hospitals and in our public health lab. Again, I just refer you to those specific numbers, which I don't remember off the top of my head, but it's literally on the charts that we've provided to you. And then in terms of the goal is to be able to use tests to answer questions that are coming up in either clinical practice or when somebody is trying to be in a work environment. Does the symptom I have, is the symptoms that I have related to COVID, yes or no? And having a quick test to answer that question with a short turnaround time is very, very important. Knowing whether somebody is immune or not is also extremely important in terms of making a disposition as to whether they can be in a specific work environment or even out in the public to be able to say that they've had this disease. So it depends on the test, depends on what it's being used for, and it depends on the question that you're trying to answer. Some of the tests are very good at answering some questions and not others. The antibody tests, I think, will tell us a lot about the immunity in the community, to be alliterative. But some of the tests that are out there, really, we don't have enough information about how reliable they are in terms of being able to say, yes, a positive test really means positive and a negative test really means negative. So until some of that information is really well known to both patients and providers, I think we're going to have a lot of uncertainty about how to use these tests.
Okay, we're going to get into the texted questions now. The first two are going to be answered by Supervisor Nathan Fletcher. They're dealing with the homeless population and testing at the San Diego Convention Center.
This question is from Lisa Halverstadt, a Voice of San Diego. Can you provide an update on COVID-19 cases in the homeless community and testing at the San Diego Convention Center? How many homeless people staying at the convention center have been tested versus staff and first responders who are also working there?
So we didn't receive an update since yesterday's briefing on testing in the convention center, so the numbers we gave yesterday are the latest numbers that we have. We also don't have a breakdown in terms of how many of those are staff and how many of those are residents. We can ask for that detailed information and see if we get it. One number I did want to give you that you asked for yesterday, Lisa, was the total number of unsheltered individuals that have tested positive, not at the convention center. So at the convention center, the numbers are what they were yesterday with no positive tests reported. But out of the total of San Diego County, out of the 2,491 positive tests we have to date, 18 of those have come from unsheltered individuals. And then real quick, the number Dr. McDonald was referencing is today we did 1,514 tests, brings us to a total of 36,434, which is also available on the slides we made in this presentation. And you can see right there. Now, those are just what's been reported to us. We assume that prior to entities reporting regularly, there was more that was done, but that is the total being done to date. All right, second question.
Okay. Second question is from Cliff Albert, and he's from Kogo. We have received a couple of calls today about seeing a barbershop on Palm Avenue near Bayer Boulevard in South Bay that was open for business. Do you get reports like this often, and how does the county enforce the non-essential business closure order?
Well, we do get reports. I might need to go investigate a barbershop to see if they're open or not. Number of us might, but what we're encouraging folks to do, Cliff, is go to 211sandiego.org. And there is a link where folks can report non-essential businesses that are open, and that report will be routed to the non-emergency line of the jurisdiction who's there. So the two options, if you see someone doing something you don't think is consistent with the public health orders, is to either call the non-emergency response line for that jurisdiction or go to the link at 211 San Diego, and you can submit the information there.
Thank you, Supervisor Fletcher.
This next question deals with personal protective equipment, and Rob Sills, the director of our Medical Operations Center, is going to respond to that.
Yes, this is from Lindsay with the Union Tribune. Yesterday, Dr. McDonald suggested a shortage of PPE was one factor limiting the expansion of testing. How much more PPE do we need to protect everyone who will be conducting tests, and how is the county going to obtain those supplies?
Well, thank you for that, and that's important to remember. We always talk about the PPE kit, which is eye protection and then respiratory protection, gown, gloves. And doing these drive-through testing or doing the COVID testing, it is an aerosolizing causing event. So we need the face protection for the eyes, as well as the respiratory protection, which will be the N95 respirators, and gowns. We're doing okay, except for the gowns. We're critically low there. We do have enough right now, and we are using decontamination processes for this PPE kit wherever it is safe to do so. So right now, we can expand our testing and provide the amount of safety, the level of safety for our public health nurses and other clinical staff. And we'll be watching that closely, and we continue to request things, equipment from the state and the federal government, as well as private sourcing. So all that comes into play, and then we're in communication with our clinicians so that we know what we can do safely for our team.
All right, thank you, Rob.
These last two questions deal with COVID testing, and we're going to ask Dr. McDonald to respond to both of those questions.
This is from Terry Figueroa from the Union Tribune. Today, Governor Newsom and the president said the state of California will get 100,000 swabs for testing next week and 250,000 the following week, with more to follow. Has lack of swabs been an issue here in San Diego, and will more swabs make a big difference in testing capacity, or are there other needs like PPEs or transport that we still need to be resolved?
Well, all of the components of conducting a test, whether it's a swab, transport media, having personal protective equipment, personnel that can do it, individuals that know how to run the machines, reagents for the machines, kits on the machines, are all important. I can absolutely tell you that there have been some systems that have had short-time shortages of swabs, and so the more swabs that are delivered, the better. I know that even some of those swabs are even being 3D printed, let alone being manufactured, I would say, in the traditional way. So more swabs is better. And again, I think that helps us on our way to doing more testing. Just remember the number of people that live in the state of California. If you do the math, I think we're probably going to need a lot more swabs than were referenced there. But again, any amount that is contributing to this supply chain is going to be extremely helpful.
Okay, and this next question is from Guillermo Mendez from Univision. There's a recent autopsy report that reveals the first COVID-19 related death in the United States happened earlier than previously thought, February 6th. How certain are we that we did not have any COVID-19 related death before that first case was reported?
What do you mean the first case that was reported in San Diego, probably?
Yes.
I think actually every jurisdiction that's looked at this, whether it's first case reported, whether it's first death reported, hospitalization reported, has looked back and understood that the virus was actually present and potentially being transmitted from person to person much longer than suspected. Remember, even in China, where the first cases were detected at the end of December, and then they started to take action in January, they've looked back and determined that probably this virus was circulating in Wuhan, China in late October. And I think literally every jurisdiction that's looked at this has said, hey, it's been earlier than we thought. We're at a point where we may be able to do some more looking back, frankly, with the number of cases that we're having now. We have information on individuals who are tested for respiratory viruses that we can go back and look at, as was done in Washington State. And they determined that the virus was actually there earlier than they realized. It's a little harder to look specifically at deaths. But we will work with our medical examiner to determine if there are any potential deaths that occurred before our first reported death that might have been related to COVID. And again, it's important to look back to understand origins, but really at this point of the outbreak, we're doing a lot of work in real time to look forward to see what's going to happen in the future. So I don't have any direct knowledge of a specific case that we're concerned about, but we will do that sort of look back, both with samples we have available from patients that were tested for viruses and in this specific category of deaths, to be sure that we can fully describe the impact of COVID-19 in San Diego County.
Okay, great. Thank you, Dr. McDonald.
That completes our media questions for today and responses. Before we break, though, clearly, as we are going through this crisis, there is still a need for blood donors, and particularly for blood plasma. So we encourage San Diegans who are healthy and able to do so to call the San Diego Blood Bank or the American Red Cross and help us make sure we have an ample supply of blood available for those that need it. And also, again, blood plasma is extremely important right now. And so if you're so inclined, we encourage you to call the American Red Cross or the San Diego Blood Bank. As we do from time to time, we like to have an uplifting story. And what I'd like to highlight today is the generosity and kindness of San Diegans throughout this crisis. And I want to recognize some of the inmates at the Las Colinas Detention Facility. There's 14 women who are members of the Las Colinas Sewing Program, and they have made over 10,000 facial coverings since March. These facial coverings have been distributed to inmates at other county jail facilities throughout the region. But, obviously these women are at Las Colinas for a reason. But we certainly appreciate them giving back to society in this particular way. We thank them very, very much. And speaking of facial coverings, please remember our mantra to stay in place, maintain your space, and cover your face. We'll see you tomorrow afternoon at 2:30. Thank you.